Before I go to the regular agenda, if the council would allow me, I would like to ask our city manager to take some time. I know you all have, and I certainly have been answering email after email regarding the vaccinations and where we are as a city. A lot of misunderstandings out there, and I would like to ask the manager to please address these items at the time and how we can get word out. Thank you, sir.
Thank you, Mr. Mayor. As you noted, we've received a lot of inquiries in the city regarding vaccination planning and deployment, and I really appreciate the opportunity to try to provide some clarity to our community about some of the things that are going on. I think the first thing, the point I'd like to stress is the Virginia Department of Health is responsible for vaccination planning, the distribution, the rollout, and they're doing so largely through the local health districts. And that's an important point. When we talk about the Chesapeake Health Department, it's not a city department. It's the local branch of a state agency. So they don't report to the city manager. They don't report to city council. They're independent. They're an agency of the Virginia Department of Health. However, even though they don't report to the city, we are in very close partnership every single day, have been throughout the entire pandemic with the health department, and they've helped us manage through to this point. We've got very long and deep relationships with the health department, and we're relying on those relationships really to try to do everything we can to assist the state in rolling out the vaccine. And I just want to emphasize that point, to assist the state in rolling out the vaccine, because the state certainly is in the lead and ultimately responsible. Dr. Welch, who of course is the health department director, and her team, they've been with us since the beginning. And we as the city, as I mentioned to you last week, we stand ready to assist them with anything that we're permitted to assist them with, and really anything they need. But those needs are changing, they're dynamic, and they've dramatically increased with this new phase of the pandemic. But we do remain ready, committed, and we are in fact working with them to do whatever it is that we can. So I want to let people know that, in addition to that commitment to doing anything that we're permitted by the state to do, and I want to list some of those things in a moment, but I want to reiterate something that can't be said enough. Before I talk about all the things that we're doing, if there's one point that people take away is there isn't enough vaccine supply nationwide to meet the demand. So everyone is facing the same struggles, but the bottom line is there is not enough supply at this point in the system to meet the plan that the state has laid forth to roll out the vaccines. And that will continue to be the case for the foreseeable future. I keep repeating that because there's a lot of misinformation out there, and one of the best things we can do is to provide up-to-date information and to help manage expectations. And with regard to providing that up-to-date information, I know you've seen it, I've seen it, we're hearing a lot about it. It's been widely reported that several of our region's localities have moved into phase 1B. You saw that Monday and Tuesday of this week, many news reports about that. What wasn't reported is that Chesapeake was the first in the region and one of the first in the state to move into phase 1B. We did that weeks ago. It was reported at the time. Would have been helpful maybe if the media reported that as part of the story, that Chesapeake also in phase 1B, but I'd be remiss if I didn't tell people listening tonight, Chesapeake is in phase 1B and certainly has been for several weeks. It really started here in Chesapeake when the health department elected to begin vaccinating teachers, and that was a few weeks ago. Phase 1B will continue in Chesapeake and in all other localities for the coming weeks, and will only be expanded beyond phase 1B until vaccine supplies allow. So I would expect several weeks, if not months, that we'll still be working through healthcare providers, essential frontline employees, and the elderly. So the decisions about who gets the vaccine, and that's another question we get a lot, those also are made by the health department. So we provide guidance and assistance and recommendations, but ultimately they make the decision, and they're doing the best they can with the information and resources they have to make those very difficult decisions. Now I'd like to turn specifically to some of the things we're doing here in the city of Chesapeake to assist the state with these responsibilities. First, I mentioned this last week, but we have now just this week received permission from the state to use our EMS personnel as vaccinators. So the second I received that permission from the state, we immediately authorized our team to begin to assist in those efforts, and that's beginning this week. In addition, we've secured short-term and long-term sites for mass vaccinations. I'm going to mention this a couple of times, but one of the things we're also doing is learning lessons from other localities. We're not at this point publicizing those locations because there's no vaccines when people show up. And you've seen that in other localities that are reported mass vaccination site. They've had hundreds or thousands of people show up at those sites with no vaccines to deploy. So while we have secured those sites, we will begin promoting those sites once we're able to take registration and provide those vaccinations on a long-term basis, and that will be in the coming weeks. I don't know if I mentioned this last week, but I think it's been fairly widely reported. The state set up a registration system, which is really a key to get people access to the vaccine. They set it up early in the vaccine deployment phase, so a couple months ago, and it immediately crashed. Okay, and it was the one and only system that they had developed. And I got to tell you, in Chesapeake, we are very fortunate that Chesapeake Regional Medical Center had a system that they were able to deploy so that they could immediately start issuing vaccinations to healthcare personnel and some of the first responders and other essential workers. Without that, we'd have really been stuck. And so they really stepped to the plate, and that system has been great as an interim measure. In addition, we've used some of our city's IT team and other resources to help develop a registration information tool that this week will be broadly deployed. It's probably the most common question that we get is, how can I get my information into the system? And until such time that the state has a system ready, what we're doing is having bridging technology so people can get their information in there and be notified when it's time to go in and formally register in the state system. We joined the city of Suffolk in assisting with getting vaccines to Bayview Medical Group, which of course has a large footprint here in Chesapeake. They weren't one of the large healthcare providers that were selected statewide to be initial recipients of the vaccine, but that's been very beneficial here in the city of Chesapeake. In addition, throughout the pandemic, we've assisted the state with messaging, and we are going to significantly ramp up those messaging efforts across all platforms. So whether you're using our social media, our website, our Chesapeake television, you'll get the same consistent messaging across all platforms. Finally, I mentioned learning lessons from other localities. That's what's working well and what's not working so well. I know people have heard about long lines that formed at vaccination sites that were announced before they were ready, long wait times on phone systems. In a perfect world, those systems would have been up and in place, and the state would have had them ready to roll when the vaccine was available. That was not the case, and so like every other locality, we are deploying the tools and developing them, really. We're developing the tools to deploy right now. I'd love to have perfect tools, but from customer need standpoint, we can't let perfect be the enemy of the good. So today we will be launching that pre-registration information site that I mentioned. Tomorrow we will be launching a call center. That call center will be staffed with city employees. Again, even though the state is the lead, they are woefully under-resourced with regards to being able to handle their call volume. So we've started ramping down some city services so that I can send those resources to the health department to stand up a call center. So that's just some of the stuff that we're doing here in Chesapeake to assist the state with this. I'd close with, I just ask for continued patience from the community as we put these tools in place to help the state be successful in their efforts, particularly once the vaccine becomes more broadly available to the community. Because of nationwide vaccine shortages, this is going to be a marathon and not a sprint, but I am confident that we do have excellent partners here in the city and that we will get through this together. So thank you for the time.
Thank you so much, Mr. Manager. I certainly appreciate that, and it sounds like you've hit all the points that I'm hearing from citizens in terms of notification, in terms of, and you know, as you said, the biggest problem is just the lack of vaccines. I think that if we had that, we would certainly be further along in the process. So thank you, and appreciate your continued work with this.